Hey besties, it's me, Carrie. Good to see you. I'm from terminal doesn't mean goodbye because you guys know how I feel about it. Just because you're terminal doesn't mean it's goodbye today. And goodbye is what you make of it. So anyway, that aside, I am stage 4 neuroendocrine cancer. My primary location is in my lungs and it's spread all sorts of different places. And today we're going to talk a little bit about, I get asked this all the time and I figured I might as well just do a segment on this of why I quit my cancer treatments. That is a huge question. And even today, it's something that I think about daily anyway, but I am glad about my choices. The other day I had a doctor's appointment and one of the nurses kind of made that a point to tell me that, hey, I saw on your charts that you are no longer doing cancer treatments and I want to congratulate you. And she said, I think that that is a really wonderful decision and I'm super supportive of you and you do you. You know, she gave me a huge hug. It was really sweet. And the whole reasons why I quit cancer treatments is because I need, during the time that I'm here, the best quality of life that I can get. The things that I've tried for my cancer treatments is I did chemo. I'm not going to name the shots that I did. Well, I'll let you know. I did chemo, and then I did radiation first, and then on my my pelvis area where I had metastasis and still do have metastasis in my right pelvic area. And then I had my left my left adnexal area where the left ovary was. I had that whole area removed as well because it all had cancer on it and it was attached to my intestines and all sorts of areas, the abdominal wall and all sorts of stuff. So I had that removed, and then I did chemo after that, and then I did a lobectomy at the very beginning of everything. They removed a little bit over half of my left lung, and then we did radiation again on my mediastinal my lymph nodes in my chest and also in my spine. We did radiation on that, and so far it's taken down the size. Radiation has taken down the size a little bit in my lung lymph nodes and in my spine, but not significantly enough to stop the pain, or it hasn't really even decreased the pain. It's been quite intense. I also did sandostatin, which is a shot, and I also did lanreotide, which is a shot. And neither of those worked really well, but for me, the other part of it was that the side effects were it was too intense for what was supposed to be doing, and considering that from all those treatments, I still have progression in my cancer. I'm just, I'm tired of the side effects of everything, and I've chosen to, it doesn't mean that I'm quitting it. Quitting, that doesn't mean, not at all, I'm not quitting. I'm just not doing everything, I'm not doing any more treatments to lessen my cancer or make it less severe, if that makes sense. Because clearly all the stuff that I've done right now and before, it just didn't take down the symptoms enough to make it worth it. In fact, it just kind of exacerbated everything and made it even more difficult on my quality of life than not doing it, So the questions that I get on that is like, well, how did my family take that? My family, of course, at first they wanted to make sure that I did chemo and they wanted to make sure that I did radiation. But after we did that and all the surgeries and everything else, they're like, Mom, you have done everything that you can do. And then I continue to do more treatments and so forth. They're like, that's your decision. And I made the decision, me personally, to make those decisions now so that way they don't have to make those decisions for me if I can't speak or make decisions for myself when the cancer progresses even more. I've also decided to possibly do end-of-life treatment for that too, but I'm not there yet, so I don't even want to talk about that yet. At this point, I am doing palliative care and continue to do palliative care. That's not hospice. My oncologist, that department, they have a palliative care specialist who takes care of that for me. This is the one who handles all my pain management, medicines, and everything else with it to try to keep me as comfortable as possible, which I'm totally appreciative of. And I do have to do for my pain management different pain medicines that help that. They only help it to a degree. After that, you have to do other stuff. But I'm trying to keep it, rather than increasing my dosages on stuff, to try to find other ways for pain management. Cannabis is a huge part of that as well. As far as my pain management, I do use different specific strains for, time of day and, what I have going on that day, what type of pain is it, what do I need to get done? Because I don't want to feel looped out or anything like that either. But, there's a lot of CBD strains that really don't do a whole lot for, to make you feel a different way, but it does help with pain. But for CBD, you need to add some type of THC in there as well to activate the CBDs. So there is a way to live life without, being stoned. I'm not trying to do that at all. I'm not interested in it. I need to feel like I'm still connected in the world. But cannabis is a huge part of my pain management, especially because it really, for me, it works like a breakthrough kind of a medicine, rather than the oxy and things like that. They hit their points of where they don't work as well, and that's okay. That's when I back up. But cannabis, certain strains really help even better for me. So I do go that route. I think it's a big discussion, and it's so personal for everybody who is either going through it or knows somebody who's going through it. At what point do you decide to stop your cancer treatments? Everybody is so different in that, and there's no right or wrong way to do it. It's up to the cancer patient themselves to decide, despite what family members may or may not feel. It's up to the person who's going through it first to decide how they want to handle their care. And does that mean that they're giving up? No, because the way that I look at it too is like these medicines that are used to help prolong our lives. And keep in mind that where my cancer is in stage 4, it's only used to maybe prolong my life for a little bit or help in pain management. And when there is progression of cancer involved in it, that means that it's really not prolonging my life longer than if I wasn't doing it, And when a lot of times chemo and radiation is used for pain management too. But when the side effects of it make it worse, and after radiation is finished and your body settles in and you're still having tremendous pain from it, like nothing, like it didn't really do anything, then at that point, it's not really helping for pain management either, or the other trials. I mean, everybody has different ways that they're going to be. Certain people, these treatments work, and that's wonderful. But every cancer is different, and every side effect is different for every person. So you kind of have to deal with that on what's really worth it for yourself and for your family. And when you decide to stop cancer treatment, what does that look like for you? It's often asked, well, what's your prognosis? And I don't go by prognoses anymore. I was given a couple of prognoses before that. I had 6 months left to live, and that was over a year ago. So, only God knows when I'm going to go. That's not science can do as much as science can do, but at the end of the day, only God knows what's what. So that's the kind of prognosis that I go by. I don't go by any type of medical stuff like that. But I just wanted to talk about what it's like for you guys, or if you know people who are deciding to quit their cancer treatment themselves, what brought them to the place of where they feel comfortable about it. What type of, I don't know about for you guys, but for me, therapy is always, I think therapy is great for everybody, throughout your lives, different reasons, different stuff. It's something that, you try not to give up on yourself. You always have a reason for something or another to see a therapist, but especially when you're dealing with cancer management, therapy is a really good thing too, because there's a lot of suppression that a lot of us cancer patients go through, where we try to mask our symptoms and try to fit in with the rest of our family and our friends, because we don't want to be excluded on everything, which tends to happen, and it's nobody's fault, but that does bring up a lot of personal feelings towards it. And so the cancer treatments themselves, of thinking, okay, is this really time to stop doing this? Or should I progress in a different way? Or should I stop now and decide later to pick up treatment again? That's also personal, I mean, what's good for one is not good for all. So that's something that really is a good idea, to check in with all the feels and go through it and decide what you're going to do with that. I feel for you guys, though, that have cancer patients, maybe your mom, your grandma, or somebody who had passed, a best friend. When you hear those words that they're ready to stop treatment, it can be very painful to hear. That doesn't mean that the person is giving up on life, though. It's quite the opposite, actually. And everybody reaches a point of where enough is enough. But there's other ways, again, to treat yourself that doesn't come from those hard drugs too. And I definitely am in support of however anybody chooses, whatever direction they choose. There is no right or wrong on this. It's just such a personal decision. And it's one that obviously, you consider your family members, you consider your lifestyle, you consider your friends and how that affects them too. But at the end of the day, you've just got to make that decision too. And it's got to be your decision alone and nobody else's. And everybody else should be in support of you long term of what that looks like. And it's really important to continue having communication with your loved ones too, about where everybody is, and figure out a plan that works for everybody altogether. But at the end of the day, it definitely comes down to you. So I want to hear about what you guys have gone through. List it down below. How did you guys go through the mental aspect of hearing when a loved one is ready to commit to stop their treatments? Yeah. So I wanted to hear, what was that? This was my decision. What's your decision? I'll see you guys later. Mwah. Bye.